Hey, everybody, it's the Glockenfleckens. We are bringing our live show, Wife and Death, to Boston. We're coming to the Huntington Theater September 14th, just right around the corner. We cannot wait, especially because we're coming to Boston before it starts snowing.
Theoretically, yes.
Hopefully, it's going to be great. It's going to be great weather. Come on out. We can't wait to see you. Get tickets now, glockenflecken.com/live. We'll see you there.
Knock, knock. Hi.
Welcome, everybody, to Knock Knock Eye with me, your host, Dr. Glockenflecken, board-certified ophthalmologist here. I feel like every now and then I need to tell you that I am actually qualified to talk about eyeball stuff. I don't just say that. It'd be a weird thing for some non-ophthalmologist to just cosplay as an ophthalmologist, although I do that for every other specialty. But anyway, I am a real ophthalmologist, and this is your one-stop shop for all things eyeball-related. And I do have some eyeball stuff for you today. We're going to talk about the orbit, one of the most mysterious parts of the ocular adnexa, which is just like a fancy term for the things that are around the eye, but not the eyeball itself. So we're going to talk a little bit about the orbit and some exciting recent developments in orbital surgery. And that'll be after the break. But first, I want to talk about a TikToker that has been making the news recently. Her name is Sydney Tolle. She's a 26-year-old. Tolle. I'm not quite sure how to pronounce her last name, but everybody knows her as Sid. And she had quite a large following on social media and gained notoriety for how she has been documenting a cancer diagnosis at the age of 26. She was diagnosed with stage 4 cholangiocarcinoma. So first off, I just encourage you to go in and look at her videos, click through a few of them over the years on TikTok. They're all still there. And just see her journey and how she approached her diagnosis and just the way she attacked chemotherapy and all the obstacles that come with a diagnosis like that. Cholangiocarcinoma, it's a notoriously aggressive cancer, devastating cancer, high mortality rate, and unfortunately it ended up claiming her life. And there's been a huge outpouring of support and well wishes to her family, and people are pretty devastated by this because I'm always so impressed by any young adult who's going through a cancer diagnosis, but especially one like this, and the way that she documented what it was like, what life was like, going through what she went through with humor, with a lightness and this positivity, and it's never all just positive. And she showed the dark side to it, and just her infectious enthusiasm for life, and it was honestly inspiring. And I feel for her family, and all her followers are mourning, and there's been news stories about it, and so I just want to give her family my thoughts and well wishes in dealing with this horrible tragedy. But I will say also, as a fellow young adult cancer survivor. Now, granted, I never. You don't compare someone's cancer journey to your own, and everything is so individualized, and I'll never claim to know what she went through, what her family went through, but I do know what it's like to receive a cancer diagnosis as a young adult. With my testicular cancer diagnosis when I was 26, and then again at 31, it's such an isolating experience to be that young and really have health issues, something go wrong like that for the first time in your life. Like for me, I was totally healthy all my life, had a pretty devastating case of mono when I was a freshman in college, but other than that, um, like it was brutal. I still remember that. But it's just different when it's cancer because it's something you don't imagine that you'd ever have, at least not when you're in your 20s. That's something that old people get. That's what you think. And I was in med school at the time, so I knew the stats. I knew that okay, I had a seminoma, which is if you're going to get a cancer as a young man, like that's the one that you're most likely going to get. And also it's eminently treatable, right? And mine was, I just had to have surgery, orchiectomy to remove my testicle. And so, physically I was fine, a little off balance, but overall okay. And but it really what you're not prepared for, even as a med student, I was not prepared for like the psychological toll of cancer as a young adult. And being in waiting rooms and just feeling like there's nobody in your life who can understand really what you're going through. And I had great support. I had family, friends, colleagues. But you're sitting there and just everybody around you is so much older than you. And you're just like, how do you process that? And I processed it through comedy, as I do with most difficult things in my life. And then the second time around, was even worse because, I had a primary cancer in the other testicle. And it was about this time that, Kristen found this organization for me called First Descents. She recognized that like as a typical perfectionist, individualistic doctor, I was not going to seek out help on my own. And I was in a pretty rough place with these cancer diagnoses. And I needed help. I needed to find my tribe, so to speak, right? I needed people around me that could really understand the physical and emotional toll it takes to like go through cancer as a young adult. Because when you think about it, a lot of attention is paid to kids and older adults when it comes to cancer. Like all the research, all the St. Jude Children's Hospital and all the research and trials, and you hear about all these things, all these new cancer treatments that are available for people in their 60s, 70s, 80s that are getting much more cancer, obviously, as you get older, but then also kids. But you're left with this big group of people like me in the middle that feel like no one's really paying attention to what is going on in their lives. You're just forgotten. And that's that kind of isolation, that loneliness that comes with that kind of diagnosis when you're young adult, when you're supposed to be making mistakes and having fun and going to parties and just enjoying your youth and you're the peak of your athletic powers and all these things. And then you got to deal with this thing in your mind. It's like, oh, this is an old person disease, even though it's not. So anyway, that's like an insight into like the psychological toll of this. And so Kristen, my wife, obviously, who's been with me, since college, she found this organization, First Descents, which is a group based out of Denver, Colorado. They put on outdoor adventure activities, like week-long trips that brings together a group of people, like 15 to 20 young adults with cancer who have been affected by cancer. Either they've received treatment and they're doing okay, or they actively have cancer. And sometimes they're going through treatment. And it's all kinds of cancer. Like people that I went on a trip with, there was a fellow testicular cancer survivor. There was someone who was being treated for brain cancer. There was, ovarian, breast cancer, all people from all wakes of life and all walks of life, and had been through so many, different types of treatment and leukemia and lymphoma. And it's just in hearing, going on this trip, which we did a a week-long kayaking trip in Oregon. It was actually before we moved to Oregon. And in hearing people's experiences, their stories, what they've been through, it was healing for all of us to be able to form those connections, to find people who could understand all this, the physical and mental toll of this. And these are, I still have friends today, people that I still know and still text from time to time. And some people I've been on trips with have unfortunately passed away. That's kind of the nature of it. Because often with young adult, some of these cancers are very aggressive cancers, and you have relapses, and then you celebrate when there's no evidence of disease one day, and then you support each other whenever the disease comes back, and it is all the roller coaster of cancer treatment and survival. And seeing the videos over the years, and most recently the last 6 months from Sid, going through that roller coaster, and thinking about all the people that I've met over the years, who were 26 or even 20 or even younger or even a little bit older, going through all of this. It's just, I'm just so grateful for organizations like First Descents, who have as their mission to help people like Sid, people like me, to find support when it's so hard. It's so hard to find that at that age. And so if you know somebody, or if you yourself are a young adult, like 18 to 40, basically, who are struggling with all the things I'm talking about, like, seek out First Descent. It doesn't even have to be First Descent. There's several organizations. Stupid Cancer is a place to go for support. There's different things. I just happened to, Kristen found First Descents for me, and it's a great organization. It's very supportive people, and you meet, you make real friendships that way. And so I've just been thinking about that a lot. So I want to, Sid was such a remarkable presence on social media. Obviously, I didn't know her in real life, but that's the kind of impact that social media can have. Like, people are devastated and reflecting on what she meant to them. And now here I am reflecting on what she meant to me in the cursory way that I knew her. But even then, just seeing little clips and reels from time to time, it left a mark on me. And so thank you, Sid, and rest in peace. All right, let's take a break, and we'll come back with a little bit of eyeball stuff. Hey, Kristen, I got to hand it to you.
Why is that?
Our room is so comfortable.
Oh, yeah.
Like the chaos of summer, kids everywhere, home from school. Like, I could retreat into my bed, and it feels so good.
It feels cozy, you might say, because it's all cozy earth.
Oh, cozy. Yeah, it's cozy earth,
yes.
Right? The bamboo sheets.
Yep. The duvet.
The duvet cover.
Mm-hmm.
I love the duvet. I didn't even know duvet was a word before I met you.
Yeah, that checks out.
But I'm so glad Cozy Earth makes a duvet cover, because it like keeps me cool.
Yes, but warm.
But like comfort. Like, I don't know. It's perfect. It's just the perfect setting to go to sleep. Cozy Earth stands behind everything they make, with a 10-year warranty on all bedding and a 100-night sleep trial. If it's not the best sleep of your life, send it back. Everything else is getting back on track. Your sleep should too. Head to CozyEarth.com and use my code KNOCK for an exclusive 20% off. Again, that's code KNOCK for 20% off. And if you see a post-purchase survey, mention that you heard about Cozy Earth right here. Hey, Kristen.
Yeah.
Now we're getting into the summer months.
Yeah.
All right. I want to tell you something that I've been hearing about from patients.
Okay.
So everybody's using lots of fans and air conditioning, which can lead to dry, irritated eyes.
Oh, yeah.
But there's a chance that those symptoms could be something else entirely.
Oh, I know the answer to this one.
All right, let's hear it.
It could be Demodex Blepharitis.
Yes. Oh, you're learning so much about eyeballs. I love it. Actually, there was a study that showed about 60% of patients treated for dry eye also had Demodex blepharitis.
That is a lot.
And the symptoms like itchy, red, irritated eyelids, they're similar, so it can be confusing. Ask your eye doctor to check for those little tiny collarettes on the lashes.
Oh, those crusties at the base of the eyelashes.
Exactly. And the good news is that there's a prescription eye drop available for Demodex blepharitis. To learn more about Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, let's talk about the first transorbital neuroendoscopic surgery performed in Ireland. So this surgery was done in 2025, but it was recently publicized and made the news recently. So here's the story. Iveta Pompova, a 57-year-old Slovakian woman in Ireland, is presented with headaches, blurred vision, some flashing lights, a little bit of facial pain, plus the right eye that her family said just always looks a little swollen. Nobody paid much attention to it until they decided, well, maybe you should go get this checked out. A doctor in Dublin noticed that the eye was being pushed forward. So this is what we call proptosis, where one eye is more prominent and pushed forward relative to the other eye. Now, the most common cause of proptosis in adults is thyroid eye disease. So that's something I'm sure that doctor thought about. Could this be thyroid eye disease? You see if there's any double vision, any cornea breakdown, any decrease in vision. You get an MRI, and MRI, CT scan would also show thyroid eye disease, but didn't look like this was thyroid eye disease. And the MRI actually revealed that there was a meningioma, which is something that can fill up the orbital cavity, just call it the orbit, that can take up space in the orbit, pushing the eye forward, causing proptosis. And now, you don't always have to treat meningiomas. Sometimes they're small and they don't cause any problems. In this case, where you're actually causing a decline in vision and proptosis, then surgery is usually necessary. So in July of 2025, Beaumont Hospital, neurosurgeon Professor Mohsen Javidpour and consultant ophthalmologist Tim Fulcher performed transorbital neuroendoscopic surgery believed to be Ireland's first time using the eye socket, the orbit, as a corridor to the brain. So this is a relatively new phenomenon. And there's obviously multiple ways to get to the brain through brain surgery. You can make an opening in the skull, obviously, for pituitary adenoma, so pituitary gland tumors, which is where I overlap most with neurosurgical patients, because a pituitary adenoma can cause a specific visual field deficit called a bitemporal hemianopsia, where the pituitary tumor presses on the optic chiasm, causing you to lose your peripheral field on either side, on both sides. And for that surgery, usually you go in through the nose. You break the sphenoid bone that allows you access into the pituitary gland. But what about the orbit? Interesting. So now this is a surgery that's called I think it's the Tones surgery, Tones. Tones surgery has been performed in the US, but is still relatively new. The advantages to a traditional craniotomy, so getting to the brain through the orbit, is smaller incisions. Great. Shortened hospital stay, because you don't have this big opening in your skull that has to heal. Limitations, though, is that you can only get to anterior structures, right? So if you have a meningioma in the front part of the brain, the frontal lobe, you're more likely to be able to reach it through the orbit. But if you have obviously some tumor back in like the parietal lobe, the temporal lobe, or the occipital lobe, well, you're not going to want to try to go through the orbit to get there, right? You're going right to the source back in the back of the brain, or the back of the skull. And so you can only get to anterior located lesions. Also, you don't have as much vascular control. So you have to be very precise, as if Neurosurgeons are never not precise. It's like the nature of being a neurosurgeon is you are extremely precise. But if you're operating through the orbit, you also, have a little bit limited control of bleeding. Now, from an ophthalmology standpoint, a lot of the potential complications of doing a transorbital brain surgery would be navigating all the stuff in the orbit, you guys. There's a lot of structures in there. So it's like trying to operate through a space that's filled with angel hair pasta. And if you damage any of that, and it's loaded with pasta everywhere. And if you damage any of those pieces of cooked pasta, you cut any one of them, then you could cause things like a periorbital numbness, so numbness of the eyelids or the space around the eye, the orbit, double vision. You can get a droopy eyelid. You can get a dysfunction of some of the extraocular muscles that would be causing the double vision, because all those cranial nerves that innervate your extraocular muscles that move your eyeball around, they traverse through the orbit. So you can get a gaze palsy in different directions. There's lots of things that can happen because the orbit is full of stuff. And so that's what makes this even more impressive to me, is that you're not removing the eye. You're not like taking it out, operating back in there or through the orbit and putting the eyeball back. You're just pushing the eye to the side, accessing the orbit, going through all the pasta, all the tiny little pieces of pasta. And then also, by the way, you still have to operate on the brain. Unbelievably impressive. And this is obviously a team approach, right? So this is going to be neurosurgeon, potentially even ENT if you're going through the sinuses at all, oculoplastics, ophthalmology. So this is one of those multidisciplinary approaches, which whenever I saw these, I don't work in a big academic center. That's where these types of surgeries end up being performed, because you have to have all these different teams, all these different specialists. So typically it's done in a big center, because there's also not that many of these cases. So you want to be at a referral center, not a community practice like mine. So it's been a while, but these were the most exciting cases to see as a resident, as a med student, just because you have all these people at the top of their fields, all working together to achieve this huge goal of removing a brain tumor. And just seeing everybody work together in action. It's like the Avengers coming together and defeating the aliens, defeating Thanos, except Thanos is a meningioma, right? So it sounds extremely nerdy to say that, but that's what it felt like as a resident or med student watching this. But here's a good question that I've been asked before: who actually is in charge in these situations? So who has ownership over the orbit, the eye socket, right? Is it neurosurgery? Is it ENT, plastics? I would say if you're talking about the end result being removing a brain tumor, I would say probably neurosurgery has the upper hand here. But you probably want to use, here's what I guess would happen. For that, going through the orbit to get to the brain, I would guess that you would have the oculoplastics surgeon get exposure first. So you have them open up the orbit, what we call an orbitotomy, gain access to the orbit, and then you might have ENT kind of tunnel through. If you have to get through the sphenoid or the frontal sinus, probably wouldn't want to do that. I guess it depends on where it is, right? But if you have to get through a sinus, you might have the ENT do a little bit of that work as well. But then once you get access to the brain, neurosurgery takes over. But in general, when I was in residency and we'd have big traumas come in, like car accidents, big facial traumas, gunshot wounds, that kind of thing, it's always basically the emergency department, they call 3 people right away, immediately: ophthalmology, ENT, and neurosurgery. And as the ophthalmologist, I knew that, like, for me, obviously the brain, if neurosurgery is involved, like, we're talking about potentially having to save the patient's life. And so they typically will have precedence. Like, that it's important to save the patient's life more than saving their vision. Vision's important, but not important if the patient doesn't survive, right? So in these types of traumas, when I would get called as a resident, I would try to get there as quickly as I could and do my very quick eyeball assessment before neurosurgery showed up. Because once the neurosurgery resident showed up, it's like everybody else out of the way, the neurosurgeon's here. And for good reason. It wasn't like an ego thing. They're just like, hey, I got to make sure we don't have to do emergent brain surgery here. I get it. And so, but if I got there after like neurosurgery and ENT, sometimes I'd be waiting like an hour, hour and a half before I can sheepishly come around the corner and be like, hey guys, mind if I do a little dilated eye exam? Which they hate. Neurosurgeons hate dilating the eyes because they can't assess for, whatever is they assess for. Anyway, so generally neurosurgery is, they take precedence whenever, there's a multidisciplinary thing going on. So other things, let's talk about other ways that lobotomies were performed. There was a thing called ice pick lobotomies. It was like the earliest history of transorbital surgery. So it's not the first time someone's thought to go through the orbit to get to the brain. So doing like an ice pick lobotomy where you take a very sharp pointy thing, you go through the inner part of the eye, the orbit, access the brain, the frontal lobe, and remove a piece of it. Fortunately, we don't do this anymore, but it was done in the 1930s to the 1960s. So even into 1960, this was performed. Ice pick lobotomies were done. This guy named Walter Freeman, who did 3,000 of them from 1930 to 1960, which makes me realize that there are still people today living, most likely, that had lobotomies done. I have never seen a patient that had one of those done, but I'd be fascinated to know what their life was like after one of these. So maybe I'll try to look further into that. But Walter Freeman, when he was doing these, he wanted to simplify the technique with the goal of being able to teach it to psychiatrists so they could do it on their own. So yeah, these ice pick lobotomies were for psychiatric conditions and clearly no longer standard of care. Fortunately, we got rid of that practice. But his goal was to try to make it as simple as possible so that a psychiatrist could do it in the operating room. I'm trying to imagine that in like modern terms, like 2026, trying to hey, psychiatry, can you psychiatrist, come over to the operating room. I'm going to show you how to take this really big pointy stick and do brain surgery so that you can do this. Maybe even in your office, you're doing some therapy. Hey, let's throw in an ice pick lobotomy. I can't believe some of the things that we used to do in medicine, but that's progress for you, I guess. All right, here's something that you art lovers could be interested in. So I have one more depiction of orbital trauma to tell you about. How about the Bayeux Tapestry? This just came up in the research on this topic. The Bayeux Tapestry, I think I'm saying that right. The Bayeux. Bayeux? I don't know. It was recently loaned from France to England to be on display at the British Museum. It's the first time this tapestry has been in England in 1,000 years. So it's a 230-foot long tapestry that depicts the Norman conquest of England, culminating in the 1066 Battle of the Hastings. Battle of Hastings? The Hastings? I don't know, but that is the only thing I remember. I remember William the Conqueror, Norman conquest, 1066 Battle of Hastings. Those are literally the only things I remember about the Norman conquest of England. I don't know if that's a success for my history classes growing up, or if that's insufficient. I feel like that's enough. That's enough as an ophthalmologist / internet comedian to know about the Battle of the Norman conquest. So anyway, this tapestry, depicted in this tapestry, is the death of the English king Harold II, who was killed, get this, by an arrow that allegedly pierced his eye. And if you have an arrow that pierces your eye, it's probably going way back into the orbit. Those things are fired quite quickly. So there you go. that's all the transorbital stuff I have for you today. That's it for Knock Knock Eye. Thank you all for listening. I'm your host, Will Flannery, also known as Dr. Glockenflecken. Executive producers are Aaron Corney, Rob Goldman, and Shanti Brook. Producer is Matt Braddock. Editor and engineer is Jason Portizo, and our music is by Omer Benzvi. Knock Knock High is a human content production. We'll see you next week.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.